Well, joining me now is the private intimate health specialist, Dr. Shirin Lakhani. Dr. Shirin, thank you for your time today. Now, with the potential rollout between, 3 and 5 years being reported, what stage are we at before we get these drugs on the market?
I think saying 3 to 5 years is possibly a bit ambitious. We're in the early stages of looking at the medications, but there are ethical questions raised by it. The researchers were looking at medications such as oxytocin, which is a neurotransmitter that forms a bond between a mother and baby and is also known as the love hormone. They're also looking at MDMA, which is an ingredient of ecstasy as well, to increase the feelings of love between couples. But my concerns are that should we be forcing these issues by messing around with the neurochemistry of the brain if those feelings aren't there to begin with?
Well, indeed. I mean, it really does pose a very serious ethical question. At what time do you think the proposal is? At what time would you take this pill in your relationship? Would it be if things are getting tough? You know, he stopped putting the bins out when you ask him to. Do you pop this pill and all's hunky-dory?
See, that's the issue, isn't it? Because the researchers involved with this are saying that it will be used for couples who are experiencing marital difficulties under the guidance of counsellors. But even with that, I mean, if a marriage is failing to that extent where you have to alter someone's neurochemistry for them to stay with you and fall back in love with you, then isn't it time to pack it in and move on?
Well, indeed, yeah. I mean, the fact of the matter is that this breakthrough will be perceived by many, won't it, as a route to actually help seal the cracks of a crumbling marriage. But ultimately, if you ain't happy, you ain't happy.
Absolutely. And I don't think that by plastering over the cracks artificially by changing your brain neurochemistry is going to solve the issue. I mean, I work with couples where I deal with physical problems that affect their intimacy. So, for example, I treat women with menopausal atrophy or couples who suffer with sexual dysfunction. But these are couples who actually emotionally want to be together. We're not looking at couples who are emotionally distant and trying to fix cracks.
Yeah, what would your advice be to someone that is, at a low in their marriage? I mean, divorce rates, of course, are going up and up and up in this country. Do you actually think that's a good thing? Do you view more regular separations as a good thing because it's people being seen to actually utilise their personal choice?
I think there's two sides to the story. I think one issue is that we're becoming less tolerant and we're less willing to put up with things. So people might see separation as a quick fix to end a relationship that's not working. But there is the aspect of if you're not happy with who you're with, you do have the choice to move on as well. And we're living longer. We're in a situation where actually people aren't expected to be in monogamous relationships for the whole of their lives. So moving on, having more than one partner is probably more natural now.
Yeah, I mean, I'll be interested to see what my viewers say to this one because it all sounds very exciting, doesn't it? But as you well say, there are certain ethical questions that have to be answered and debated around the use of these drugs. But private intimate health specialist Dr. Shirin Lakhani, thank you very much for your time.